year on is almost like, around the corner. When I came into the United States, before I started my board exams, I met a lot of people that, unfortunately for me, they were doctors, but they didn't go through the American health care system. They did not want to pursue further because of some personal reasons. So I was left alone and I struggled this alone. So, but within myself, I was told that it's actually a very difficult exam. This time is a little bit di kind of, there are a lot of info that people share, but I think that time is a little bit restricted. You rarely see whom to talk to. And a group like this, like Joey Group, wasn't, I didn't know about it or it wasn't existing that time. So I struggled things on my own. But that time, on my own, I was like, how do I do to help myself? So I wanted to go into doing volunteer work because then I had a clinical background in OBGYN, which I knew I'm not able to continue here because of a lot of reasons. So I now told myself, how do I get into the health system? I said, okay, I'm going to do volunteer work. I started applying. When I applied, the positions that are open for me is the area that I will maybe wheelchair patients, stuff like that. It was difficult. When I get in there, I was like, how do I cross this level? So it's a little bit difficult. And somebody from Nigeria with a very thickened, if there is an English word like that, accent, it was difficult for me to mingle. So I now said, okay, and I became pregnant. When I became pregnant, I told myself, this is the opportunity for me to make it. Then I was in Washu then. I was in Missouri then. I told myself, this pregnancy, I want to attend my antenatal care at Washington University School of Medicine. And when I get in there, I want to request that the GO, because when I had already searched and discovered that the program director for OBGYN is, I wanted to be in their clinical team. My purpose is when I get in there, I will request that he will be the one to, why I like America, what you request is what they give to you. So I requested that he become the person that sees me. So two, three attempts, they did not grant me that. They said he was so busy. The third time I requested, before I go, I requested that I want him to evaluate me. He is the clinical team leader that I would like to talk with him. They granted me that opportunity. I seized it, prepared myself. I was going for ANC, but that wasn't what is in my head. I got in there and he was like, oh, this is the mercy that I've been looking to see me. This is the mercy that I said yes. I told him everything. We discussed about my pregnancies and all that. In fact, I told him that time I just I have been doing this OBGYN thing. He realized that I have experience in the OBGYN. We started talking. I told him about my steps and all that. Then I had finished my step two. And I told him how I had struggled. I have, sent in over 100 applications to get into research. At WashU, they don't accept volunteer in GYN. My Because I have no other experience apart from GYN, I was looking for where I can get in, and it's only GYN I can talk to prove myself. So he said, yeah, they don't accept volunteer, but however, maybe how about research? I said, yeah, I'll be very, very grateful. However, I have applied over 200 applications and no one even respond to me. Whatever, nobody ever even turned in. He said, okay, that I need to apply another one. They sent me a link, I applied. This was at Natal Care I attended on a Wednesday. As at Monday, I got a response. I had an interview on Tuesday. I started work on Thursday. So it was that singular opportunity that my work as a clinical research assistant, they just created a position for me. That position wasn't existing before that my interaction with the man. He wasn't existing. They just created a clinical research position. For me in that department, this is a research wing from the GYN department. They created it and they said it was a contract position, 6 months. I want to tell you more things. So what happened? I started on a Friday. I told myself, this is 6 months, but I'm going to make sure I really make an impression. To cut the story short, before 6 months, they gave me a project. I was supposed to do some kind of chat review and all that. And 6 months supposed to be the time to round up everything. Before 4 months, I'm done with that project. Ha, they were like, they can't believe it. My director couldn't believe it. So what they did was they now asked me, okay, yeah, Akudo, we know your contract will be expiring in 6 months. Would you like to continue with us? I said, of course. That was how I continued with WashU. From there, I rose to clinical research coordinator. Well, to cut the story short, it was that WashU in my CV that changed every applications I do. Even coming into California, even going into most of the things I have done. Whenever some people see that my WashU experience, it always make a difference for me. Why I brought that story is I like if you're coming in this country, you need to be intentional in anything you're doing. You are applying for residency now, you need to be intentional. Anywhere you go, you just have at the back of your mind that that is something I am looking for. And you have even people you interact with, be intentional. Don't do anything and just relax. I don't relax, especially when I'm searching for things. This is application period. You already have built your CV, organized it, and anyway, the best way that will match to your various specialties. Of course, you would have been intentional in anything you're doing. So this is a little story, and there are a lot of why I needed to bring this story is to say that you have to be intentional in anything you're doing and don't take anything for granted. In any opportunity that you are given, like grab it and make meaningful use of it. Don't allow it to slip away. So and again, this particular discussion now is going to favor almost everybody. Because when I got into residency at Penn State Hershey Medical Center, however, I had about 6 or 7 interviews. So when I got into Hershey Medical Center, I wouldn't say I'm really very happy about that because that was the first time I heard about Pennsylvania. I was hoping I'm going to match in 1 or 2 other programs. But when I matched there, I had to accept it. When I started my residency there, everything was a struggle. Everything I do is just a struggle. I was like, something is not, is not adding up. Even when I know I didn't do really bad and others are doing terribly bad, but I'm just being figured out. Like everything is just bad. I knew that something was wrong. So what I did was I decided to make sure that every step I'm going to be taking is going to be intentional. I make sure I do things that will make my CV great. And I reach out to the great faculties because in that in that institution in the pathology, even I got one mentor, very strong mentor in anatomical pathology. I went in and approached another professor in clinical pathology and got him as a mentor. These are very great, I mean, the pioneers of the Penn State. I got them behind me and I go to them one-on-one once in a while to discuss about my career interests. So I started getting myself involved in research, but things were not just doing it was just like falling apart. Finally, it got to a point that to cut the story short, I needed to leave the program. What made me to succeed? Because people wonder, Akudo, how did you do this? What made me to succeed was I I was intentional from the start when I realized things were not going well, and I made sure that I had bridge all the gap that you don't know what else to say. You just have to like accept it. Like when they say, what did she do wrong? You're just handicapped. If you say she's not doing well, okay, what evidence you say she's not doing well in her program? How can a year one be able to do this kind of research and present it? She's doing well. What else did she not do well? She's not grossing well. What is evidence? So they had no evidence. So at the time I was like, do they want to kill me in this place? I'm sorry to use that word here. Anyway, I left. And you know what? So when I was leaving, I said, okay, in the first place, I didn't really like to be around this Pennsylvania. I had wanted to be in California. I said, okay, this is my opportunity to go to California. And it's a very tough decision to make, to move from that kind of distance. And I have my family and I have my child that was still a baby. I moved. I took that decision. I moved. I reached out to programs. I packaged my CV. I had to reach my all my attendings there. Everybody was on my they backed me up. Everybody was like, what can I do for you? What can I do? What can I do for you? Two of my mentors, one of them was in Australia at the time when the heat was too high. It was too hot. I reached out to her that see what's going on, and I got to go. She started looking for programs for me. She was like, "Akudo, I'm going to get programs for you." She got me two programs, one in Ohio, one in Maryland or so. By that time, I started talking with people in California. Before you know it, within 2 days, these are people, it takes them like 2 weeks to write a letter of recommendation. Within 48 hours, they produce me 5 powerful letter of recommendations. And that was why when I came to Howard UCLA, my chair was asking me, these letters were all saying the same thing. These letters were all, they were so surprised at the kind of letter I got. So why I was able to do this, because I'm not really, it's not that I'm too good or I'm perfect. I am intentional. I knew, I foresee what was
Yeah,
going,
babe.
and I packaged
I
myself.
still used to join all these meetings though.
I
I said, Moshi man,
presented
join our
myself.
meeting me.
So so don't get frustrated. Maybe in your current program now, you're still an intern or even a resident. You are doing things that you feel this is the best thing others are doing. But most times they single you out. You may be the only person in color. Like in my own situation, I think I was the only first person in color that have ever done residency in pathology in that particular program. Because I sat till 1960, I didn't see any person my type. And also I was told that yeah, we needed to rank you. We ranked you to be there. That was when I knew that something was really off. Anyway, so you may be doing some things in your program and you feel sometimes you're just alone. Don't get that frustrate you. Don't let that depress you. Rather, let it strengthen you. Let it strengthen you. Make sure that maybe you're doing things, maybe for instance, you're in internal medicine, you're not writing your notes, or maybe you're in clinical medicine. They use the word clinical medicine. You had come in directly from Nigeria where we don't use the EMR system,
I don't know whether it's
where you don't use the EMR system to you know, chart your patient notes. It's going to be a struggle here, diving into the residency and you're beginning to take ownership of doing all those things. Sometimes you may be very slow and they will pick it up and be nailing it on you. It should not frustrate you. Rather, look out for a way to make your work faster. Make your work faster. Don't give excuse. Like this is the thing I like to like advise. When they say, oh, why didn't you, if you didn't finish your work, you haven't finished your work. Don't even try to give an excuse why you didn't finish it. You need to accept that and look for a strategy to make sure that you surprise them the next time. Just keep doing things that will prove, don't talk too much, especially when you're in this US system, in a health system like this in America, and possibly you are a kind of person is not diverse in your program. You know what I mean? Like people of color. So be disciplined, and most times when you discipline yourself, it becomes your strength. And you have to focus on things that makes your CV great. Like for instance, in my program, I discovered that it is important to, no matter how no program, no specialty is perfect. There are limitations. There are a lot of issues in every program, every specialty that people in there knows. There is no specialty that is better. There is no program or university or whatever that you don't see issues. But make sure that you're not the type that, keep speaking up. You're the one that keep speaking up. Oh, you didn't do this. Oh, the program didn't provide this. You're the one that will speak up and it will get to the management. This is why this is what puts people into trouble. And you wouldn't know that program they've already marked you down and be waiting for how they can. And it gets to a point that everybody will become against you. Even people you discuss it with, they there is a way any story that is told here is no longer a secret. And you wouldn't say, I'm discussing with my friend. You cannot say anybody is your friend in the office. I'm sorry to say that. It is very, that you don't use that word. Nobody is your friend, they are your colleagues. And don't share any sensitive information about you, about the program with any person. So now, let's talk about interview and how you can make, can project your potentials. And these skills, these things I'm going to share now may help you, apart from, you know, getting into residency in the subsequent interviews you're going to be having, even getting job or fellowship, is going to be helpful. I learned to make sure that whenever I am, interviewing with maybe any kind of sort of interview, work related or any sort of interview, I make sure I'm very, very unique. And I make it like I project something that will make me stand out. And but I realize that people here, they want you to look versatile. They just don't want somebody they don't learn from. They want somebody that is able to give, not somebody that is almost like kind of everything, they will be teaching you everything. For instance, now I'm just talking to you like you are coming into residency, becoming an intern July next year, and you're coming into pathology or you're going into clinical medicine. It is assumed that you're coming to take in ownership. But honestly, the kind of training we had, and if you're coming from Nigeria or you just coming here, you haven't had any US clinical experience, it's going to be a challenge. But you're not going to, because of that, and you now say, I am an intern, I'm going to be taught. Some programs, they don't have that kind of, you don't have that kind of opportunity. As you're jumping in, you're taking ownership of your patients. So it is you that will decide to learn, meet people. Don't just stay around, just hide yourself or stay out of people that will teach you how to mingle, how to become like speed up. Immediately you're going into um, clinical practice. Let's use pathology where I am, for instance. Pathology is a different field altogether. This is an experience we didn't really have exposure in med school, apart from the normal, maybe um, autopsy stuff. But the main core clinical and anatomical pathology where we're doing here, it is not really that obtainable in Nigeria. So if you're coming in to do pathology here, it's like you didn't have any experience at all.
Huh.
So, and this is the specialty when you come in from day one,
Oh.
especially in the American system, everybody, and you're coming in
What's that? Please stop now.
of color, you are being they have assumed you know nothing most times. If you're coming in with that kind of accent and your color, they just assume you didn't even have, basic training, which is which is not acceptable. But you know what? You're coming to not to talk too much. Your skills, your performance is going to be showing. And you constantly have to be high for them to really believe you, which is a shame. What people do, and maybe they score like score 2 and they say, oh, this is great. You need to score like score 5 before they give you that great assessment. So now I I want you to like know that this is a battle you're going into. This is not just like as easy as you see it. Every step on the way is a battle. Every step, writing your step exams, applying for residency, getting interviews, nailing your interviews, getting into the internship, graduating into the intern to residence PGY to PGY. These are all struggles. There is none of them, none of these steps is but the time I was about to write my step exams, I was thinking, oh my gosh, if I can pass this exam, I'll just go and sleep. I didn't know that was even the beginning of the trouble, beginning of the struggle. So now, if you are coming in, have that brother sit and absorb, like prepare your mind that you're coming to absorb shock. You're going to see things that you don't believe. And some people, if they don't handle it well, you may begin to have some kind of, if you don't have a very great, let me use the word great support, even at home, or maybe you don't even have mentors, you may begin to have some kind of issues that maybe that can linger for a long time. It is happening. A lot of people are having issues that you have to start having some kind of therapy to help you, to help that person. So I want to say that once you're coming in, you need to back yourself up with things that make you great, that can strengthen you. When you come in, don't be just like fold your hand that first time. Be on a watchful look most times. Just be watching people. Don't be the one, don't just grab somebody immediately. The person is my body. Watch, keep watching for like 2, 3, 4 months. Be on the watchful look. Don't just be at, don't see your, don't, I suggest don't make any attachment at that first time. Let everybody be your friend, but nobody is really very close. Just be on a watchful look. You'll be very surprised that the person you might have wanted to be your buddy will be the person you wouldn't have wanted, because any time you have decided to choose a body, for me, I'm at risk at telling the person more things about me. And when you have spoken, you have said a lot of things about you, that story is gone. Is has now become a departmental story. At the end of the day, when you realize that you have shared your, story with a wrong person. So for me, if I am to go into internship, PGY1, again, that first 4 months, I'm not going to be close with any person. I'm going to figure out how to create a very solid CV, because it's your PGY1, the intern year, the department will make impression about you. And if you're somebody of color, they want to they already have almost always the level they are placing you is not the same level they're placing others. So you need to work very hard to come up almost very close, or even now go higher. And what can set you that high most times is your research. Usually maybe some other leadership skills. They will see that, oh, this resident has these skills, but this other doesn't have it. That thing that can set you aside and that can make programs know that, oh, this is somebody we have. Because it's really difficult for residents to be into research or publications, and leadership skills because it takes a lot of time. There is no time during residency. Then talk of having extra time to be involved. So if you can do anything extra that others are not able to do, believe me, the program, they're going to hold you very closely. They're going to hold you very closely. That is that for that. That it can set you up from, if you can start that from your intern year, it's going to make you going to keep you, at a very different level from others. And program, they're going to respect you because even they attending, most time they don't have time to do all these things. So if you are doing it, they are respecting you and keeping you at a particular level from others. So that is what I try to talk about here. And you are going to apply for your residency positions now, and you start getting interviews. Because why I needed to say this, I may not have opportunity again to talk about this. Once you start having your interviews, of course, majority of people are going to match. When you match into your residency program, your program is going to invite you. They're going to have a kind of an orientation. Most times, some program may have you for like few days or 1 week. On that first day of orientation, a very great positive or negative impression is going to be made about residents. The chair, most times, most programs, the chair, the program director, and some other faculty members are going to be there. What they're coming to check is your personality. And they're going to make an impression that is going to be very, very permanent. If it is positive, it is great. If it is negative, you need to work very hard to delete that impression. And that is where program, when they have that kind of impressions on people, and that person is unlucky, some other people start cooking, stories against the person. The program will say, yes, yes, we already know this. We already know this. So what are those things that what are the things you're going to do on on the orientation day, first day especially, or the first week that can make that kind of negative or positive impression? Sometimes when you come in, maybe you might have read things on the internet, how to appear, questions to ask. See all those questions? Most of those questions should be asked by the AMG, not IMG. The AMGs are the ones that will ask those questions. They will come in and ask program, do you have a residency maybe week? How many free days do they have for their well-being? Of course, these are very important things. Well-being period for residents, they will have free, work days, go in, have fun. It's very important. Programs do it. But those are not the kind of questions I expect you to ask on during your orientation. It's not the kind of question program want to hear from IMG, asking a program, do you have a place where maybe resident can go in and do some kind of aerobic exercise during work? Like if you're coming into pathology, for instance, on that first day, you have come into the program, you are asking a program director or the chief resident, um, how many hours do residents gross? These are questions or answers you can actually find on your own and just, you're already there. There's nothing, not that question, whether they say yes or no, it will not change anything. You don't want to ask those kind of questions because by the time you ask these questions, they will make an impression that one, this one doesn't like to work. Two, possibly lazy. This one, they will see you as one kind of person from those kind of questions. These are real questions, but AMGs may ask those questions, nothing will happen. They know this is their life. But if the IMG asks this question, oh my God, they are going to be watching what you'll be doing. So, and also I wanted to for an IMG, they have worked with a lot of IMGs and they know that we are shock absorbers, especially those from Nigeria. And this is one of the impressions I try to make where I am, which I know they haven't had any IMG ever like IMG from Nigeria. I'm sure they have IMGs from other countries, but they haven't had any IMG at Harbour UCLA that finished from Nigeria and came in there. So I have to make a very great positive impression now to show them that IMGs from Nigeria are great candidates. And this will pave way for subsequent IMGs that want to apply, apart from California issues of taking IMGs or whatever. So this is very, very important. You need to appear as a shock absorber. Like you will just say, if people are doing this work, I will do it. And bear in mind that when we are hired for residency, hospital hired you to work. Yeah, you're gonna be trained, but they hired you to work. But that issue of why you complain, oh, we gross for 6 hours, 10 hours, we are supposed to know this, these histories and decide to apply it there or not. So if you already match in that program, no need to mention those things. It will not change things. It will also it will only make things, worse. So I would, if I'm to go back now to start as an intern, I'm telling you, I will never, even if I'm dying, I will not say, this is too much, this, because it will not change anything. They're not going to reduce my work if I say it. But rather, it will just kind of create a negative impression that it's like this one doesn't like to work, or why are we even taking, they will start thinking something different, like it's not even, maybe it wasn't my intention of saying that. So I don't want to create any bias. But it's in my mind, I can go back home and tell my husband, these guys are killing us. But I will not say it there. So that is what I wanted to say about that. Also, when you are coming in as an intern, that is the time you have to be very, very careful about your stories. Because any story you say at that time, I think I've said this previously, it is no longer going to be a secret. It's going to be a department. Everybody, they will leave their story. They'll be talking. You'll be very surprised that that small thing you said, you told somebody, one person, even program director knew, is already, the chair is already aware. Well, I heard you had this or whatever, you do this or that. You'll be very surprised. And you don't know is everywhere. So they have a very different culture here. In terms of information, the way they see information, they see it as interaction. They don't, there's a way they see it, but culturally it's different from where I came from, where that sensitive information, when you share with somebody, is just within the person, unless the person decided to, talk about it. But here, if you're sharing with somebody on your own, you feel the person will hold it. It's not gonna, you will just use it as fun. They will just laugh and be talking about it. And some of those information that can it can create some kind of bias on some people. So what I'm trying to say is you don't kind of trust people and tell them stories just to entertain them. It's not ever going to be a secret. And some of them, they will add salt and pepper and cook it up and it become a very big story. So as I said, had already said this earlier, when you are coming in, be careful choosing your body or Alice. Make sure that the person you have to finally confide and be very close will have to be somebody. People may say this is it kind of symbiotic. You shouldn't have a parasitic kind of relationship with any person. It has to be the person, somebody you have to, you're going to gain something you're really lagging behind. You want to figure somebody that has that quality. You want to learn it from. Yeah, sometimes maybe you are coming in, you don't have moral research ideas, or you don't really know how to gather quick. If you're in clinical practice, clinical training, you don't know how to gather quick, concise clinical history and present it eloquently, or how to summarize your EMR histories. And you discover that you need to figure out who among you does those. Yeah, you have to key in there. The person will show you, and you have to learn. You don't. You need to check the area that you really need to constantly learn, and you figure whom to you have to grab that person. This is because you're not only going to be, I mean, so I want to say something here. In Nigeria, we can easily ask questions. Ask question, nobody care. Just ask your colleague. Ask any question any question you can ask. The experiences I've already gathered here, they will always tell you, do you have any question? I'm happy to help. I'm happy to answer. I'm happy to help. Yeah, they're happy to help, but the questions you keep asking, they will think there's a question you ask, they will conclude that you know nothing. Maybe that question you may know it, or you may even know the answer somehow, but you felt I needed to ask so that they will think you're the type that asks questions. Never. Before you ask question, make sure you have tried to figure the answer. Try everything you can figure it. Make sure you have tried. And that is why you need to have a very strong ally that's a little bit higher than you. So that when you have tried to gather the answer and you're not able, then ask your ally. If you can't solve it, that's the time you can escalate the question to a higher person. Not every small thing you go and ask. Sometimes some people, you go and ask your attending. Every small thing you ask your attending. Every small thing you ask maybe your chief resident or the senior resident. Yeah, it's good to ask questions, but make sure you have tried to figure the answer. Because there's some questions you ask, they will conclude. In fact, nobody will trust your skills. They don't trust your medical knowledge. They feel, is this person asking this kind of question? What kind of education did this person have? They don't even know, they don't understand that you may probably know the answer, but you're the type that likes to ask questions. I know most of us will know this strategy, but I needed to talk about it for one or two persons that may not know the implication of asking questions, any question, because you have heard that they have opened the question chat and say, ask any question, I'm happy to help. I'm happy to help. No, they are happy to help, but it's not a very happy help. Try to figure the answer, try to figure it by all means. Yeah. So, and I also wanted to tell you that workplace here, it's I don't know, make it strictly workplace and try to limit having that kind of yeah, you can have friends, yeah, we'll laugh, we eat, we'll go out to eat, but limit your interaction. You usually end up not being a very not a workplace. Okay, it's we have to be very, very careful because I don't know these things they call jealousy. I'm not sure how it works, but I usually don't believe in it. But it is real. And you have to know how to share your information. Not everybody is really very happy. People may be having some personal things that are making them unhappy, and you're sharing your positive stories all the time to a particular person. I don't know. You have to be very, very careful. That's what I have to say about that. So now I'd like to say a little bit about the the things that I feel that you should not do, you know, if you want to survive in residency. Some of these things you can still go against it, you survive, but mostly and in most programs, um, if you are already struggling or if it is a program that don't really have Black dominance or a program that haven't had opportunity to train people of color, the first day you are stepping in there, they are watching you. Some of them don't wish for you to be there, but they don't have any option. So when you come in there, I think it is also important to make them surprise them and kind of change whatever impression they already have, rather than helping them to build it up. They say, yes, I said it. I know it. That kind of thing. Most programs, of course, almost all program provide scrubs that you wear. in our just like last few weeks ago, somebody came into the hospital. I wanted to give somebody, a package. So the person called me. I jumped down with my scrub. We're like, is it how you guys dress? The person is actually a pharmacist in Nigeria. She was like, is it how you guys dress? I said, yes. She was surprised. So just that way they give you that scrub. If it's possible as try to wear that scrub. You get why, as a talker. Try to wear that scrub. That scrub makes you to be at the same level with everyone. It makes you appear humble. It makes you literally appear like you are ready to work. That's how I feel whenever I'm on scrub. I feel I am good to go. I am ready to shock any work, bring it. Like we are the same. But by the time the hospital give a scrub, that's how I feel. But I have my own personal scrubs that I interchange once in a while. But by the time hospital gives scrubs, I know some, but I'm talking about people of my same level of color. I'm not talking about the AMGs. Those guys, I don't still see them at the same. There's some things they do. If I do it, I don't get away. So based on my own qualities, I like to wear that scrub just to remove that kind of barrier. So when you wear that scrub, when you now leave that their scrub and wear your own all the time, those your expensive scrub, you jump on your sneakers and all that, you don't know whom you are offending. You don't know who is making any impression. Some people may say, I don't care. Yeah, you may not care, but you don't know who is who. You don't even know. This place, everybody in the health system is very, very important. The cleaners can even set somebody up for elimination, a cleaner. You'll be so surprised. How would they do it? You don't know how they do it. There's a kind of gossip line that goes here, and some of those cleaners are very powerful. They go to an extent that you cannot believe. They can also help you get a job. I'm serious. Some of them, what is limiting them from getting those kind of, levels because of their qualifications, but they have the connections. Sorry to say that. So it is good to keep, just remove that kind of barrier because as you're coming in, people already they have, they are seeing you as somebody, you are black, you're a doctor, you're even an African trend, you know nothing. So who are you? What are you trying to show? So I would wear my scrub most of the times. Then, and if you're in you discover that most hospital, and I have said it and over, even the most ranked hospital in the US, they have issues. They have a lot of issues. So anywhere you are, don't think your hospital is the worst or doing is the same issue you're facing in your hospital is being faced by the highest ranked hospital. So don't be the one that keep complaining. Or even you want to be bold, you want to show that you now report or put it in writing email and send to the program director or send to an attending. It's not a good idea. I don't think it's a good idea. If anything they are doing that is wrong, so long as you can jump and pass, in my own opinion, so long as you can jump and pass and do your work and get away, just keep jumping and passing and be doing your work. Don't report. If you report, even if it's anonymous, let me also say this now. You see this feedback that I give, it's an anonymous feedback. I hope you know at the end of the day, it's not anonymous. So you don't do things that will implicate any person, especially maybe attending that is not doing very great, or that is doing some things. I know there will be a point you can speak up when he's trying to get you into a very big problem, or you know what, this is not really right. You can speak up, but in a very good day, things that doesn't stop your work, that doesn't affect you directly, I strongly suggest you don't report. If he's not directly targeting you, jump and pass and do your work, graduate, get your certificate and get out. Their hospital will still remain their hospital because that has put so many people too in problems that they don't know how to get out of it. And once you are putting that email, it cannot be retrieved. So this is because by the time you keep reporting things, maybe for the maybe if it's things that had to do with the ancillary staffs, those ancillary staff, when they gang against you, they will really gang against you. Like they will put all their energy to make sure that they really deal with that person seriously. Like if it's in pathology, there are a lot of things that goes wrong for those ancillary staff, some of them pathology assistants, all those histoteks and all that. Try to be at the same level with them to make your work easier for you. If they make a mistake, I thought you would have, okay, no problem. I'll fix it. I'll fix it. I'll fix it. The person will be relaxed, but not just like frowning your face. Oh, why did you do this? Did you not do this? You don't know this can put patient into trouble. Once you say that, they are seeing you as a threat, and they are scared. They can now do anything to make sure they get you, they just want to make sure that you don't become their problem. So it is not a very good idea to report anything that doesn't directly affect you, doesn't directly, affect your job or anything about you directly. I will just leave it and do my work, jump and pass. So because even if the AMGs are reporting this, if I'm in the gathering where they're having meeting about that, and this is a meeting that it's compulsory that I must be among them. When they're making those their contribution, I would just be smiling and be nodding my head. Seriously. If it's a meeting that, Akudo, you are one of the team, this thing, you have to be here. Today, the meeting team is to discuss about how to make sure we fix maybe whatever they want to fix. And they are targeting to send a letter to program director, copy to chair. I'm going to fold my hand, I'll be nodding my head. Because the reason is because I am not going to, anything I say, it is my name that will be put first. And even when the AMGs talk about this, they're not targeted. They feel this is their culture. They can speak up. They can, I don't know why. But if it is, if it is people like us, they will project your name. And it is your name that will overshadow everybody, all those ancillaries. And when they see you, say, yeah, we know it. She's the one that will bring it up. She's the one that will bring it up. So this is why I feel if you're in that kind of situation, except you are being targeted, I would just keep mute and be on a watchful look. So that's how it is. And also, I also strongly advise that it's not a very good idea to be cunning. It backfires. Like being cunning, like if you're during when you come in now, some people are in a batch of 6, 4, or 5. Within that your group, make sure you're always the one that looks approachable. Somebody needs a coverage. They always feel comfortable coming to you. Oh, Akudo, would you like to cover me on so day? Please, can you help me? I need to finish this. Don't look like somebody that is not reliable. Like they will say, oh, I'm not sure she can do this. Are you sure she's not going to? Just always appear to be, reliable and don't appear cunning. Like those things help because in a very good day, there will be a day you need help. People, even in your absence, they will fight for you. It has happened to me several times. It happened to me at Penn State. My colleagues fought for me. They were like, no, this is not true. This is not true. This is not true. Anywhere I am, they're pursuing me. Whenever I go to conference, everybody surrounds me because they knew that, oh, this is not true. This is not true. But it doesn't really mean because I'm the best, but they knew that this is I come as I am, and there's nothing like you look good, but behind you are another person. So try as much as you can to be good, to be reliable, especially among your friends, among your colleagues. or your level resident um, colleagues. So I also wanted to say things that you may want to do that can help you thrive while in residency. So, and I've talked about this one, exceptionally being good to your colleagues and taking all these calls, like be reliable. So, um, but for instance, let's talk specifically for pathology. Most programs, when you're coming in at intern level, you may be assigned to, present tumor boards. When I started presenting tumor board, I realized that my subsequent colleagues, they just take all those histology slides and just show it to clinicians who doesn't understand what those cells are. Nobody. So whenever the pathology sections, they are showing the slide, some clinicians are even discussing because they don't understand what is this, what are you talking about? They don't understand. They're just waiting for pathologists to finish their own so that they'll continue. So when I started presenting my tumor board, this started when I was in WashU, when I used to attend tumor boards. It can be very, very dry and so, unengaging. I was like, what are these guys showing? You don't even talk to people what the tumor you're talking about. What are we listening? So I made a decision that when I go into residency, I'm not going to present my tumor board like this. So when I started presenting tumor board, I I would just a little bit talk about why I'm doing this immunohistochemical stance. This is why we have chosen this. And I try to tell the clinicians, this is this tumor, and this is this tumor, this is why it is not this tumor. So subsequently, I realized one of the days I finished my presenting my tumor board, my colleagues told me that Akudo, you took a long time, that he's very, very surprised they didn't stop me. That usually they stop them and say, oh, the time is up. But I took over like 30 minutes and nobody stopped me. I didn't know. So later on, in my subsequent tumor board, one of the clinicians wrote to me and said, oh, thank you very much for taking your time to explain this. This is becoming interesting. I realized that it's because of how I approach. So what I'm trying to say here, I'm using pathology, for instance. I know that the clinical team may have your different ways of presenting patients and some kind of internal conferences. Make sure you stand, make things that are unique, things that can set you aside. Just like when you want to do something, do it with passion, do it with like you know what you're doing, not just following the same trend. Oh, this is how they do it, this is how they do it. You see, you usually hear that word most times. Oh, that's how we do it here. Even when something is wrong, somebody is keeping a cup very close to the edge of a table. And every other subsequent person that comes, they will keep the same cup very close to the edge of the table. What about if the cup falls apart and break? Nobody cares. When you ask the question, they say, "Ah, this is where they usually keep it." You don't want to ask question why, or they'll take it and keep it where you think it's supposed to be. Don't I feel it's not a good idea. For me, when I come in and I feel this is not the right way it's supposed to have been, I will change it and keep quiet. And you see, people will come in and say, oh, wow, Akudo, you did this. Wow, it has been bad for a long time. Wow, thank you for doing it. I say, oh, you're welcome. But you know it's been bad. You're the same person, you have been doing it wrong and you knew it's bad. That is the tradition here. But by the time you change it and put it in the right place where it's supposed to be, you are remarked, and they will remember that. They will talk about it seriously. So these are one of the things that set you aside. Why am I doing this? If I am even if I am an AMG, I may not probably go this extent. Yes, because they already don't have the same impression like me. But because of where I'm coming from, I want to make sure that I have blocked all the areas that can, if you're already biased about me, you are handicapped with any negative info. And this is also to pave ways for my subsequent people that are coming, so that if they have maybe like they have 90% negative impression about IMGs from Nigeria, by the time I leave that program, maybe it's like 20%. Say, we had somebody that came here. Oh, wow, wow, wow. That kind of thing. This is the reason I don't want to be selfish about me. Like, I know I'm going to finish my training and get away. Whether I'm good or bad, I'm going to finish. But what happens when I leave? Do I close the door or do I open the door? It is very, very important to me. So that is that for that. So for pathology colleagues here, pathology resident applicants, this area I specifically want to talk about that for you. You're going to get interviews. I know I may want to do some interview preparation for for the group or when the time comes. But maybe this can also be applied to other clinical teams, even though I'm specifically talking about pathology, but try to make sure there are so many things, there are certain questions you cannot ask during interview. These same questions, the AMGs will ask it and they give them kudos for asking these questions. So you as an IMG, it is not a good idea to ask. If you ask these questions, they are not going to rank that person. At least I know the two programs I have been to, if you ask this question as an IMG, unless they don't have any other applicants, they're not going to consider you as worthy to be trained in that program. You're coming into a program, during a level of interview, you are asking a program, how many times do you gross in a week? So for some of us here in the group that don't understand what I mean by grossing, in pathology, in anatomical pathology, we process our human specimen, we call it grossing. It's just to cut the specimen, put them in various cassettes to process it. Ultimately, they'll come out in a slide where we look at it in a microscope and decide malignant, cancer, if it's inflammatory or whatever it is. At that level of processing that specimen, it's called grossing. And some programs are really notorious for heavy grossing. And some of them, this grossing is the scariest and the most difficult aspect of anatomic pathology because it's really overwhelming. Sometimes you gross from morning to night. Some people gross if they're in such paths, they can gross maybe if it's a soft specialty programs. Whenever you are in that particular cervix, you gross. If it's 2 weeks, you're going to be grossing every day, every day, every day, every day for that 2 weeks. When you're coming into that program or you're asking that before you ask questions, it's good to have read about that program, know how they do things. If it's a program that is a soft specialty, you will know that they will be possibly be grossing every day. You wouldn't ask this question. What is the intention of asking this question? You want to make the program feel that we are over-laboring people. The program director will be ashamed to answer this question. For putting her in that or him in that hot spot, you are already a red mark. Then you come back again and ask, because AMGs are asking the same question, and you copied it. Possibly you have attended virtual, what do they call it, virtual ground or whatever, virtual house. Forgotten the terminology. So if you have attended that virtual,
Open house.
yes, open house, yeah, correct, thank you. If you have attended that open house and the AMGs have asked this question, you wrote it down in your subsequent open house, you begin to ask, you are not doing well. Those guys are asked this question, they have a lot of options. We cannot ask these questions. What I will do, I will not ask that question. I don't have choice. What I will say is, if I match, if people are surviving, I will survive. What do I do? I have no choice. And you are also coming in to ask, do you gross on weekends? What is the intention? What is it? What do you have at the back of your mind for asking this question? So if they gross on weekend, The program want to feel bad that we don't give our resident weekend to rest. You want to know before you ask your question, is it putting you on? You need to ask questions that will project you as the real candidate. You want to ask questions that will make you stand like somebody that can absorb the shock, somebody that's exceptional. You want to ask a question that will put you in a position whereby programs say, oh, we want this person, this is the person we want to get. I tell you, every program, whether clinical or pathology, every program that is training resident, they want a resident that is a shock absorber. They want a resident that anytime, any day, the person can walk. They don't want a resident that will not be able to perform their work. They are hiring us to work. They are training us. So is that part of training where you will learn on training? And another thing again, residency is work. That's how I see it. You have obtained all your training, basic training in med school. You're coming into residency to put in that clinical, knowledge and teachings. Then you learn. It's kind of an apprenticeship. Then you now do. It's a self. For me, I feel it's more of self-teaching. You ask questions when you're in doubt. You read. You see what they are doing. You ask questions. So when they are not giving you work, you're not asking why this work. You are putting the program in a very, they feel so ashamed to answer this kind of questions. And it can be so embarrassing in a kind of virtual open house like that. You're asking this kind of question in a where everybody is listening. Program is ashamed to answer. If it's a program that is on heavy engrossing, it's heavy engrossing. They will just look for your name and mark it red and be waiting for your application. They will just sieve it out, even if you have the highest score or whatever. They don't want you. They're done. So don't ask this. How much does PA is pathology assistant? So most programs in pathology, some programs, they don't have pathology assistants. And those guys are very helpful in grossing. They also teach residents on how to gross. Unfortunately, some programs don't have it. Before you ask questions about pathology assistant, make sure if you are going for any open house, no matter how little time you have, read about that program. If you want to ask questions, read so that you are not asking contradicting questions that can put that program in a very hot spot. It's better you don't ask at all. Just show your face there and smile, or ask questions that are just general questions. Don't ask any question that will make you are very intelligent to ask questions, No, you have to be intentional. This is my first statement, be intentional. Ask questions that can make the program will see you as a shock absorber. This is a good to go resident, not a question that will you want to you want to set the program director in a very in a very hot seat. So, and also maybe there are some programs too, so before you do autopsies, the histotech or the autopsy technicians, they bring out the organs for residents to now dissect and gross and do things. Some programs you are to do the entire thing and bring out the organ. If you look at the program and they don't have autopsy technicians, and you may have asked and discovered they don't have it, it's better not to avoid that. If you want to go to that program, don't ask any question. In fact, the summary of this page, this slide is to, before you ask any question in any of your interview, virtual house, make sure you're not asking questions that program, they are having issues, they are not able to, answer it comfortably. They are ashamed to answer. Don't ask any question that can put them in a very hot seat to answer. Remember, program directors, they are not fully in charge of changing most of these decisions. Is the hospital management. And some of these issues, the program director and the chairman have been doing some applications to correct them, but because of long issues of hospital management decisions, they have not been able to actualize their aim. So when you come and ask the same question, it is really put them in a very hot seat, and it can be embarrassing most times. So there are so many other don't ask questions here, like, asking, do you get coverage as needed? What is the point asking that question? I haven't come into the residency, you're not asking if you will be getting coverage. So you're intending to be calling off, or you're intending to be traveling, or I don't understand. So these are questions I have seen. Before I wrote down these questions, I saw people asking these questions. And these are AMGs. They ask this question and they answer it comfortably. And some programs still rank them. So, but I know that any IMG that have asked this kind of question, program director will mark it red. Forget it. But the IMGs, the DOIMG, AMGs will not also ask this question, because they're a little bit somehow uh, another kind of they also have challenges in matching in residency application most times. So for me, if I am to start residency application again and interviews and all that, if I'm to ask questions, see the kind of questions I ask if I'm coming into pathology. And this can also be applied to other clinical residency, but you can coin it in a way that will fit into your various specialties. Like if I'm going into pathology, I would ask, do you get diverse cases? Why am I asking this? Do you get diverse cases? The reason I'm asking this is because I know in pathology pathology is a whole medicine. So if I'm going into anatomical pathology and I'm restricted, I only maybe I don't usually get, let's say for instance, I don't get um kidney biopsies, for instance. If I don't get kidney biopsies in a particular hospital and I finish my training in anatomical pathology, when I get out, if I see any kidney lesion, I'm not able to make diagnosis. I wouldn't even understand what is malignant or benign or inflammatory, or I don't know. I didn't see. But if I have seen all diverse cases, I see kidney, I see prostate, I see uterus, I see brain, I see eye, I see lymph node, I see everything, diverse cases. I am good to go. So if I ask this question, program will know that yes, this person she knows what she wants. She's open, she wants to learn. And they are waiting for you to hear more questions. And I come again and ask, okay, maybe before I ask this question, I should have, read about the program. I know that they don't have pathology assistant. And I will ask them, I see you don't have pathology assistant. Who helps, when we are grossing difficult cases? There are some difficult cases you need help, pathology assistant. And if a program don't have pathology assistant, how do you get help when you have the kind of, cases? And this is a good question. The program director or whoever that is, in the open house, they will be able to say, oh, yes, whenever we have big cases, the attending on duty or the specialty attending that is signing that case is usually called to come and help or direct you on how to, gross that specimen. They already know that you are coming in, you're asking, you're trying to package your tools, how to figure yourself. You know where you're going. You're just somebody that they kind of figure the kind of person you are by asking these kind of questions. Then you can also ask, like some programs, they don't have research, whether clinical or in pathology, they don't have time for research. And you're coming in, your resume is showing you've been involved in a lot of research. And they may probably want to take you because of that, because most programs want a resident that will be bringing out their name. You go out, present your abstract, present your poster, win award, win. They want you're raising the rank of that program. Some program want that. So when you're coming in with such a CV, You want to also show them that you want to continue. So by asking them, do you have research mentors? And I know that before you come in, you may have asked, you may have searched about most of their faculties and see that some of them are also actually in research. But sometimes when they have, you still need to ask, do I have opportunity to have research mentors? I see most of the faculties are into research. Am I able to kind of, do they have open policy, open door policies for me to choose a research mentor? It shows that you're not just having those things in your CV just for documentation. So these are, and the one and number one and most powerful question, whether you're in pathology or clinical medicine, is important to ask at every time you have that opportunity to have interview, whether even after residency for a fellowship, even when you're applying for job as an attending. If they ask you, do you have any question for us? I will always ask, what if when I was if I'm interviewing as an intern or a resident, I will ask, what is the expectation of a PGY1 resident? It's an open question. What is my expectations? Usually the first question I ask, because based on the answer, I will know the kind of subsequent questions I will ask or I will retrieve. If I'm applying, when I was applying for my fellowship, I asked, what are the expectations of a fellow? When they give me that answer, I write it down very seriously because the answers to that question will guide how I will come in from my day one in that program. Because if you stick to that answers, what they say, it's going to help. It helps a lot. And it helps you to know. I asked this question when I was applying for
I can
my
send you to your address.
I asked this question when I interviewed for my fellowship. So in my fellowship, they allowed one of the histotech to interview me. He was the chief histotech. It looks like he has over 30 years of experience. So he's a big name in that program. So I now asked him the question, what are the expectations of a fellow in your program? He said, yeah, we like a fellow that is not always complaining. This one he didn't do this one well. We didn't do this. We didn't submit this. We didn't do this. I was shocked. See that answer? I was like, I cannot forget this. Because in a very good day, that you may be tempted to, even if you didn't complain to your colleagues, you may be tempted to like see any of those history and say, oh, why is this this thing didn't stand well? Why didn't it not stand well? With that answer, even if they didn't stand it well and I look at the scope and I didn't see anything, I'll just go back and say, oh, hey, Mr. Charles, I'm not sure if we can resend this. That wasn't a complaint. Unlike saying, why didn't this thing's always not standing well? It's not always standing well. Not that kind of thing. So it is always good to ask some of those questions. And when they give you the answers, make sure you're making use of it. The answers are very, very important. So I'm also asking the question about feedback. It's also very important. That's another second most important question to ask at every interview. That kind of make an open, they feel you as somebody that is teachable, that is, that is open to feedback, because even some of us that are currently in residency, that feedback can be so bad. And here, the feedback, the way they understand feedback, no matter how much we have even put into restructuring feedback, they still do not. Some of them are really just bad. What they will be picking out is those ones you didn't do well. They will just be dropping it in your MedHub or whatever platform where they put feedback. But the things you're doing great, nobody will ever mention, which is bad. And they have refused to adhere to giving constructive feedback. So now, when you know that this is really a problem, always ask, how do they give feedback? Like I personally, whenever I want to start any rotation, I will send a message to the rotation director that I'll be coming into I'll be rotating within 1 month or so, and that I will want honest feedback and at the end of my rotation, and also ask for suggestion on how to make this posting or rotation very effective. I intend to read this, I intend to do this, I intend to learn this, I intend to focus on this. If I'm going to be starting any rotation from a Monday, I usually send that email on Wednesday or Thursday of the previous week. So by the time I'm finishing that rotation on a Friday, I will send an email that please, I will, or on a Wednesday or Thursday, I will say if it's okay to have kind of a feedback. I would like to know the areas I did well and also the areas I did not do well. I have always written it this way because I discovered that when you say they should give you feedback, they will only give you areas that you did not do well, which can be so bad. And the areas that you have done great, even you want to hear that you have to cushion the areas you didn't do well. Like for instance, if you eh, maybe maybe you sign your cases, maybe you usually like have an overflow, you're not able to finish signing your cases within 24 hours, and they will now give you a reference and say, yeah, in 1 or 2 times, yeah, I see that some cases you are not able to preview them within 48 hours. But they don't want to mention the areas that, oh, your diagnostic skills are good, your grossing descriptions are good, blah, blah, blah. They don't want to mention that. But when you are in person with them, they have always been commenting on that. So when I want to request for feedback, I will want to hear the areas I did well and the areas I didn't do well. If you give me that feedback, I will look at both and I'm fine. But if you give me only areas I didn't do well, it can be depressing. We're all humans. So it's good to ask, how do you give feedback to your residents? It's a very important question to ask. So before I know I have talked too much, before I pause a little bit to answer the questions, I wanted to kind of summarize um, my talk here today. And as I said from the beginning, I said it's important to be intentional in anything you're doing. So long as you want to match into residency, remain into residency, finish as a resident fellowship, even as an attending or private practice or where it's always good to be intentional in workplace. Then also, I have also advised that you don't get frustrated based on whatever you have on your CV right now. It is you that will make it happen. It is you that can change any negative impression on your CV. They are going to see you during interview, prove them wrong. Prove them wrong. Say you'll be able to bring, present an impression they will, because most people already know that some people are not good exam takers. If you're having a low score and the low score is what is making you to be depressed, you have already had opportunity to appear in an interview. At the back of your mind, you are thinking about that low score. Why would you do that? At the level of that interview, prove to them that even you should that you're not a good exam taker. And by the time they assess you, some programs they already know that we've hired very high scorers in the past, but they didn't really perform as expected. Whereas the low scorers did well. So nothing should make you perform low at the level of interview based on what you recall that is happening at the level of your CV. Don't do that. And also, I have also advised that you appear versatile. During my interview, whenever they ask me, what are the things that you do, that makes you, what are your extracurricular or hobbies? I'll always tell them I'm a farmer. In California, I have my farm. In fact, what I harvest here, the garden eggs and all that I harvest here, it it kind of like 2 buckets every week. I told them
Oh,
I'm a farmer.
I thought you was gonna be able to feed the whole
I
of West
told them,
Africa or
I
something.
told them I'm a farmer. In Nigeria, we have fish farming. We have a fish farm, very big one. So I have that joy in farming. I like watching those fishes. I come in every day when I want to water my farm here. I feel joy. When I come back at night, sometimes 10 p.m., I'm watering my farm. It kind of a stress. It kind of makes me, it's a kind of a stress reducer for me. So this is do things that is as like tell them things that they were like wondering, who is this? Like, how do you do this? You have this baby. I tell them I wake up every day by 5. I go and drop my daughter in the school. I prepare her food. And how do you still do this? And you're still, I mean, how you still go for your conferences, you do your abstract. How do you do this? Put them in a hot seat that they'll be wondering, who the hell is this person? So, and I have also advised that it's very, very important to guard your stories. And there are some stories that have to be very, very personal. And don't trust any person at workplace. Nobody, I tell you, workplace is a workplace. Restrict workplace as workplace. And be very careful in telling your stories. You're not entertaining any person. It's going to be a departmental story forever, like forever. Even when you have left, when I get into some program, they will be telling me, oh, there was this resident, she told us, you will be very surprised, you know. So follow the do's and the don'ts consistently. Remember, sometimes at a time, you may forget some of these things, but keep consciously remember that, oh, this is where I am and this is who I am and that this is what I need to do. And you have to also remember that whatever you do, for some people that are also aspiring higher, like I know maybe when you finish your third year in clinical residency, you may want to go into practice. Some people want to go higher to fellowship. Some people after fellowship, they want to go into some other higher, greater, heights. Remember that you need to build a very strong impression and have great mentors. Their letters are very powerful. Letters are very, very powerful. I cannot, stop emphasizing on this. My letter of recommendation was what I didn't who am I? Who would we want to go and talk to? It is my letter of recommendation that talked for me. He was standing there for me, and I was just holding my hand. The letter was like talking very loudly. So you have to, be very, very careful, intentional, and you consistently ask smart interview questions. So I think at this point, I will keep the floor open, and I'm very, very happy to answer any questions that you may have. If I'm not able to answer, I will direct it to Dr. Julie, and maybe if there are questions I'm not able to answer very well at this point, I may go back and research about them. Possibly, I'll respond to the person personally.
Thank you so much, Dr. Akaraonye, for the wonderful presentation, and thank you for walking us through your journey. So yeah, question time. I'll read through the chats, and then we'll have a hand up. Dr. Zoe, please, can you go ahead and mute yourself? And
Oh, Dr. Akudo, thank you for this. I don't know who's talking. Hello? Hello?
Hello?
Can you mute the person, please?
Yes, Dr. Bakari, can you mute? All right.
All right. Hi. Thanks, Dr. Akudo. I was laughing throughout your presentation. It was really, really great. It's funny enough, you said just about every program has their own challenges, whether even if it's Harvard, Yale. And like you said, if you go into programs that you're really the minority, you're likely going to face a lot of challenges, especially as a woman. It's worse for a woman compared to a man. As you mentioned, when you go in there, you're kind of labeled like an angry black bitch who knows nothing. That's actually before you come in, that's what they'll see, whether you like it or not. And then you kind of have to prove yourself, as you mentioned. Other than that, Chris' presentation was great. In terms of how, I don't know about farming, I'm scared of cockroach, talk myself warm. I don't be like me. I told them personally I enjoy shopping at Victoria's Secret. Maybe that's why I ended up in Vegas. But don't do what I did. All right. But the main reason why I'm actually raising my hand to talk is this application season is coming up this coming week. I just wanted to quickly tell you guys a few things to keep in mind as it's coming up. Again, if you've gotten to this point, please congratulate yourself. I actually feel, especially those that have papers, I feel like this is an excellent year for you to apply. For the older graduates, I think this is a year for older graduates with all these restrictions. Thing is, make sure as you're applying that you target these areas that are quite unique to IMGs and are targeting your score categories. So now let's go to personal statement, things that I want you to keep in mind. Make sure you craft a unique story that pretty much demonstrates your passion, whatever it is you're doing. So instead of simply listing your strengths, you might, for example, give meaningful patient encounter, which can essentially illustrate the attributes that make you trustworthy candidate in the eyes of that program. You also want to emphasize things like longitudinal involvement. Always look at quality over quantity. So highlight one or two term projects where you were deeply involved. Um, because this tends to demonstrate stronger connections and commitments than briefly participating in many activities. Okay, so again, you don't want to list too many, maybe one or two. It's usually one. All right. You can address your setback but don't tell them you went and took step one or step two or step three times. Please don't. It's not the time for it. You might just mention you had a minor delay, minor setback, and then you keep going. You don't need to expand. In terms of your CV, I also wanted to highlight a few things. Keep in mind that when it comes to your CV, you want to stand out. You need to go beyond just explaining your roles. You need to highlight whatever it is you've learned, the skills you've gained, and if it's applicable and how essentially those experience adds to you being a great physician. So the most important thing is again, briefly describe your roles in a nutshell, not in order. Just describe your roles, describe your impact, and discuss the skills you've gained and highlight about what you've learned and what you take away from this experience. All right. Best of luck. Make sure, even if some people get interviews right away, some starts having interviews around October, November. Again, what you need to do is keep practicing, and because you never know when you can receive them. All right. Good luck, fellas. Take care.
Thank you, Jerry. Thank you for this support and your encouragement. I'm not sure if I can go ahead to answer some of the questions I'm seeing on the chat.
Thank you so much, Dr. Zoe. Dr. Akaraonye, I'm happy to read it out for you if you're happy with that.
Yeah,
Otherwise,
good.
right. So the first question is, please, can you explain what you learned in Penn State that was a challenge and how you navigated? This is coming from Chichi.
Yeah, Chichi, wow. My experience at Penn State was a very tough one, and I can say like not if that experience happened to like three people, one person it is difficult for even one person to survive
I'm not
it.
sure. I'm not sure if do you want it at this point, since it's you're literally done with your core lectures, you might want to turn off the recording so she can freely talk.
Yeah.
If anybody sends it to your old program.
Sure.
Hey, your wife is here. Okay.